Dr. Reddy, you have mentored generation of students. I don't mean that generation. For decades, you have been educating the students. What is the biggest skill gaps you see in the new graduate entering into the clinical practice today?
I think skill gaps have always existed. I think one reason why this summit is going on is to plug those skill gaps. And there's another, saying which I've realized is what you learn in dental school, actually you don't actually practice, because the way the changes are happening in practice or whatever. So there's always something new, something which you have to learn and adapt yourself so that you're actually fitting into the practice. For example, when we were in college, it was like, how many root canals or crowns you have done, but maybe once you're in practice, something else is actually evolved and you have to practice that. So skill gaps have always been existed, but two key takeaways, whether it is in 90s or in 2025, is if you compare to the US schools, is you're not learning the art of business. Today, if you're a dental surgeon, you have to get into the high street, do a dental practice. We have learned all the skills to be a good dentist, but we don't know how to run a dental practice. So the financial skills, the business skills, the marketing skills, and overall all above, I think I will say 3 Qs is, we have all those IQs, but where is the EQ and where is the SQ, that is the spiritual quotient? Because all these things fit in, as the social skills are very, very important, because to deliver that patient-centered treatment. So personalized treatment is what people are looking for. So these are the different skills. Luckily these days, what is not taught in schools, people like you and other academies are there, they are fitting in. All the answers are out there, but people have to ask the right questions and seek those answers there. Because the systems don't change. You can't reform the education, you can't change the council and all those things. So it's a good business opportunity for a lot of people. Learning opportunities are there as well.
Sure, sir. So, Dr. Sajiv Yadav, he has mentioned about the gaps which are there. Now, what we see, or maybe a little understanding of mine, the curriculum is not changed much or negligible, right? So, what are the key reforms needed to make the dental education more outcome-driven and globally accepted?
Good evening, everybody. Curriculum has not changed since the inception of dentistry in India. I agree to that point. But the mindset and the thinking of the policymakers and the students and the staff is slowly taking a change. What I would like to emphasize now is we should be more globally oriented towards the students. They should learn how to be a competent person. Like Dr. Ramana Reddy told, he should have enough training, not only in dentistry, but about the skills and how to market dentistry and how to promote himself, because it's a professional degree. You cannot expect any support from the government or your family. Once you get a professional degree, you have to survive on your own. So now, basically what we have got now is competency-based. No, what we have got is content-based curriculum. It's all content. How much you know, how much you don't know, which does not be useful for that student in the real world. What now required is competency-based curriculum. For these changes to come, few things are moving in the government, but I would like to emphasize that the world is going, previously it was ancient, traditional and modern. Most of our students are modern, most of the teachers are ancient or traditional, and the government is ancient. So we can't expect any support from anybody. Now what I would like to emphasize now is be like a sponge. Observe whatever you see. Don't waste your time on social media. See a good content-based evaluation. Don't depend only on your teachers or your gurus. Try to inculcate the hobby of being a sponge so that you can observe whatever you can be able to observe within yourself. And tomorrow when you come to real life, you will realize there is a lot of difference between real life and real life. So basically, content has to be built in the students. We have to develop modules. Digital dentistry, we have to develop modules for digital dentistry. We have to develop modules for integration of the engineering part of dentistry into the marketing part. So what I've noticed is that we don't know what you people can do. And you people don't know, sorry, I'm telling you people, the electronic people don't know what we need. So this gap has to be fit in properly, because there's so many, just because some is were aware, they will talk to talk, but most of the people who come to institutions are, you can say, bookworms. Basically, they get a seat because they get a high rank in the NEET. They are not street smart. We have to make our kids street smart. To make them street smart, we have to inculcate the habit of giving them a competency-based curriculum.
So the question now to Dr. Srinivas, it will focus on making them street smart and focusing on competency-based curriculum. So from your experience at Apollo Skills, how should this institution should complement this traditional degree with, as sir mentioned, about practical, I would say, problem-based learning approach, competency learning. So are you already working on the dental space, or is this particular platform is giving you an opportunity to get into it?
No, I think it's a good question, Vishy, and good evening, everyone. We have done a very limited work on the dental education, but we started doing some work because we see a big opportunity there. So basically, just for me to remember, I've kept the mnemonic dental. So the first D is to develop the teachers. I think one of the biggest challenges that I'm seeing, both in the medical as well as dental education in particular, is teacher development. So because the area is evolving, be it digital, be it patient centricity, adoption of technologies. So I think developing the teachers is the first thing, very critical thing to improve the digital dental education space. Then the second is e-learning, which Dr. Sajiv and Dr. Ramana Reddy have just mentioned. I think the continuing education, building skill-based modules and integrating them alongside the dental education. So generally the medical dental educations are long. So there's an opportunity to learn by integrating technologies. The N is, I think, the newer infrastructures, building center of excellences by collaborating with the industry. Industry is ready to collaborate. I think there is some rigidness in the infrastructure because of the councils, be it NMC or the Dental Council of India. But I think if you are establishing a center of excellence, that's the N. The T is teachers, again, professors of practice. While the new education policy by the University Grants Commission now allows professors of practice, who are the practicing kind of dental surgeons who can actually come and teach in the colleges, the DCA has not adopted it yet. That's what I've seen it. So I think it's very important to get the dental practitioners into education. The A is ABC framework, which is Academic Bank of Credits. It's very critical because the CNE points, the continuing nursing education points, when you're actually teaching them digitally, if you are linking them to ABCs, the Academic Bank of Credits, and linking them to DigiLocker, they will have a great career progression, because now the ABC points have validity across all the program, be it medicine, dental, or any other education. The L is, again, languages. Dr. Sajiv just mentioned about being a global dentist. I have seen a lot of migration of dentists out of India because of opportunities. So if you can also learn a language, I've seen there's a shortage of dentists coming up in Germany, in Japan. So because of the aging dentists, they had enough dental graduates in these countries, but most of them are aged now, and the newer generation have not taken up dental education. So learning a language 5 years, during those 5 years of education, will help. So these are the 6 things, I think, which has a mnemonic dental to remember. So if you adapt this, I see a definitive transformation happening.
Interesting. So Dr. Reddy, the other day, you've been mentioning about your openness for the adoption of many such new insights, right? So, and I believe it was a very important thing which he mentioned about new languages like German and all. So I would like that, have you seen any infrastructure, academic infrastructure in India implementing like simulation labs? Okay, do they have any such kind of investment, separate budget, or does the management have a vision? Okay, in your experience, overall I'm asking.
I think there are some fancy simulators and all which are not really required for the Indian market. The simulators which we do have are addressing the this thing. What is lacking is the mindset. Actually, you have to understand the philosophy of learning. The important thing is to practice, observership, internship, mentorship, and in the end is whether you are doing in simulated models or doing on the philosophy of learning is you're trying to minimize your mistake and improve perfection. The idea of simulation is trying to do the right thing for the patient. So how we are getting into it is in the old traditional old methods are also good enough where patient material is not there enough. Dental basic models are available, but what the student has to understand or the practitioner has to understand is you have to know the you get into the habit of practice, and also somebody should be there to guide you. That there's no point in doing hundreds of hours of practice without knowing your faults. So you have to have an ideal mentor. So it's a mix of it. So I would mix simulation with ideal mentorship and guideship, which will actually help in the philosophy. So you have to assess it, how are you getting there, what is your objective in mind, and how are you learning that. So whether simulation is helping, observership or mentorship is there, we have to see what works for us. They are really high-end haptic models and other things which I have tried hands-on in demo models and all, but I still think this is not ideally suited for us. What is there is good enough, but we have to get into the job of practicing on a right mentor.
Dr. Yadav, in this platform itself, we saw that there are a lot of speakers who come from a core dental background, but they went about into medtech companies. Okay, some of them went into consulting companies. Some of them are, they're into health tech companies, right? So what I just would like to look at from that aspect. There's a place called Amirpet in Hyderabad, wherein better not to record it, but let it put in a very glorified manner. There is a place called Amirpet where all those unemployed engineering graduates, they come there and they dream for H1 visa. Okay, so what I see is that, do we foresee that this dental professionals have got such a wide scope of business, the opportunity? It could be from a med tech, it could be from a digital tech, it could be from an education point of view, it could be from a CRO point of view, it could be from a medical communication point of view. So is institution like yours are open for embracing such new modules into your curriculum, or it's already in place?
If I get the question right, only thing constant in this world is change. My favorite topic for all my students is what after BDS. I could identify around 70 IAS and IPS people who have left dentistry, not because dentistry is not fetching them the required livelihood. They went out after with a passion. I basically tell my student, take dentistry or medicine or engineering or law as your basic graduation. Don't depend on medicine, don't depend on law, don't depend on dentistry or don't depend on engineering. That will be your basic graduation. Take that as a platform to fly high and go where your passion lies. There's no point on making a very good doctor when he's not interested in curing the patients. So basically the point here is the mindset of the parents, mindset of the society, the mindset of the teacher has to change. And even the students are ready to go out, but they are stopped by the parents or the institutions or by the any XYZ or social society and all those things. So basically I see a gap where the trainers need training. The trainers, I mean we the trainers, we are all trainers. So we need to change the thought process by allowing the students, let it be in any stream of this thing. I don't think people keep on telling that dentistry has got no future. I will say even engineering has got no future. Even
That's
medicine,
what I told Amirpet.
even medicine, there are 38 medical college of government sector in. So that means we are producing around 3,800 graduates per year, that too in Telangana. So don't depend on the institution, don't depend on your parents. Just keep on thinking. There's a lot of material outside. If you think out of the box, you will be surprised to know our IPS officer who was very famous for making that, breaking that Tollywood drug. I forgot his name. He was posted, huh? Akul Savarwal. He's a dentist. Do you imagine one IPS officer who spoke back to a BJP leader? She's a graduate from my school. So there's no truth.
Dr. Srinivas, you have done quite a lot of work in terms of academia and industry partnership. So, Dr. Ramana was talking about observation, internship, mentorship. Okay, so how can collaboration can happen within academy and the private players like MedSkill, which in turn with the device manufacturers and XYZ for the dental training? Is it viable? If it is viable, how should academic institutions should approach people like you to make their people more employable? Okay, so I just need a route, because there is a route. I'm sure that's what you did it for the medical and the nursing people.
Absolutely. No, there are multiple continuing education opportunities. I think Dr. Ramana Reddy and I were discussing outside this panel that how we can collaborate. So yes, the continuing dental education opportunities are immense, and we strongly believed that it should not start at the end of BDS or the end of MDS. It can go alongside your dental education. When it comes to industry collaboration, I think I just mentioned that there is a scope to set up COEs from the industry, from the manufacturers of the devices, so that you have a first-hand experience of using these new generation devices, the digital classes. So basically, there are 4 gaps that I've seen in all these curricula. One is the clinical competency gaps, which can be fulfilled through collaborations, through short-term skill-based programs, as well as getting a first-hand experience on the cutting-edge technologies that are developing. That is the first gap. Second is the gap in the quality. So while the hospitals are getting the NABL and NABH and other accreditations, even the dental clinics, so there's a need to have some quality-based education, so that can be another module. Third is the patient centricity, communication with the patients. The dental doctor should be able to explain the complex procedures to the patient in the right way. So that's the third gap. Fourth is the digital skills. I think if all these 4 skills can be integrated into their learning, alongside that will have a there's a great way forward for collaborations.
If you can answer me that, what is the one barrier which we must overcome to modernize our institution? What is the one barrier we must overcome to modernize our institution?
Everybody is resistant to change. That barrier has to be overcome. Change, I will tell you, every day it is happening. What happened yesterday will not happen today, and it will not happen tomorrow. The fear of change should be taken out. First point. Second point, we should give incentives to the trainers to develop their skills, and we should tell the students, from the student's perspective, they should not depend on their mark sheet. Please don't carry your mark sheet when you go for an interview to big people or interview to some other clinic or abroad. All of the students should have their e-library of all the documentation of the cases, documentation, electronically recorded documentation of the cases and their curriculum and what they have done, how they have done, what was the outcome, 1 year outcome. I just can't do a small dental filling there and after next day it is gone. It should be recorded. Evidence-based e-library should be developed by every student so that he will get lot of job opportunities where he will click. See, everybody is same. All the students more or less 5%, 10% here, everybody is same. What makes you stand up out in front of the patients, in front of the interview panel is your e-library. Even I have noticed in most of the other fields, they just take pieces of papers and go for an interview with their degrees, with their mark sheet. Everybody should go with their CV, e-CV.
Dr. Ramana, if you could reimagine dental education, say like, I have my favorite direct, I'm a Brahma, okay? So if you could reimagine dental education from ground up and you are going to design a future ready dental school, how it would look like in 2040? We have 15 years of time. And it will become tathastu.
I think the mindset, we as an Indian mindset, we have to change. I think we always
I'm
have
not asking about change. How it would look like, how you would like it to be look.
I think it's more friendly, we have a more, structure, more friendlier learning environment and more interactive rather than, the traditional. Maybe we have that British approach. Still feel we can follow the Indian Gurukul approach where you have a more one-on-one formal relationship with your teacher. And we have to look at Indian solutions for Indian problems. Most of the time we are looking at Western solutions for Indian problems. So as we said, we still have large population who still are not accessible to dental care. So what can we do? But we have to look at new solutions. And fundamentally, as being an academics, what I am missing these days is above all education, we need moral education first, bottom line, fundamentally. So our values are those are missing. Once you have those, others they will learn on their own. I don't have to teach them. Once your foundation is strong, they will learn. So I as a teacher, what I'm missing is that foundational values are missing. So we have to revisit, not still go, somebody was saying top bottom or bottom top approach. So we as a nation or as academicians or whatever, we have to see, and then it's a reset which we have to look. And as you said, I would always love to be in the open, like that Shantiniketan Tagore approach. Can I learn with the environment, find herbal solutions for common medical problems? And you had actually given me a different question, which people so the thing is, what am I looking at the future? I'm giving the answer is how will the future look is, again, is we have to have a more preventive approach. It's more often a treatment based approach. Is I have to fix the problem before it comes.
Sure.
And that is what is there. Even Kiran Malavia was saying that. I think that will also create business, that will also create value, that will create space for everybody. So we are mostly in a treatment based approach. And again, in the end is the future will be personalized and individualized. The touch is missing. How much
And nano robot will also be there.
No, if you say dentist, we are always touching the patient. You go to a medical practitioner, is looking more at the reports. You go to any corporate, I can tell my recent experience. They even don't have time to speak to the patient. So that is missing. So future will be, we have great doctors, but what we need is good doctors and good dentists. Or I'm not saying they're not there. Am I touching the patient is what makes you a good dentist or a...
I got it. Srinivas Garu, you want to say something in this? How the dental education should be in 2040? How you look like? How you foresee? In a very simple one-liner.
Yes, I think preventive healthcare will be the focus. And definitely there are a lot of technology adoption, lot of haptic simulation, because there's a lot of psychomotor skills, a lot of cognitive skills, fine motor skills required in dental education. So for more practice, possibly I'm expecting a VR and haptic simulation more adopted into the education.